Good evening, everyone, and welcome to an extra special panel tonight. Tonight we have a panel of all youth discussing non-communicable diseases, the epidemic, and why it is time to lead. So first I'd like to start by introducing our panelists. To my right, we have Crannie Cranston, Executive Member of St. Kitts and Nevis Association of Persons with Disabilities. Next to Crannie, we have Genesia Pemberton, Youth Health Advocate of Lake Health and Wellbeing. And next to Genesia, we have Tivon Browne, Dr. Tivon Browne of the Ministry of Health of Nevis at Eureka Health Services. So tonight we have a very extra special discussion in store. We are talking about policies, we're talking about government, we're talking about education, we're talking about the global campaign on NCDs. Please stay tuned for an exciting conversation.
Welcome to the beautiful islands of St. Kitts and Nevis. Today, we'll be spending time with the Wilberts. They're a happy family that love liming, and with plenty of food and drink to go around, life is good, but not for long. Sadly, the Wilberts never paid attention to what they ate or drank. And when asked to reduce those sugary drinks, they joked and said, "We will, but not today." Unfortunately, a year later, Mr. Wilbert had a stroke. And a few months after that, Mrs. Wilbert was diagnosed with diabetes. From hospital bills and the cost of drugs to time off work, this began to take its toll on the family. But it wasn't until they saw the effect it was having on their children that they finally decided to make a change. You see, the Wilberts realized their family was already sweet enough, and a healthy lifestyle was the best gift they could ever give them. What gift will you give your children?
Welcome back to the all-youth panel on non-communicable diseases. So let's start off by talking about what inspired this conversation. This month, we are celebrating the Global Week for Action on NCDs, or the Global Week for Action on Non-Communicable Diseases. This is an initiative by the Global NCD Alliance, and the local St. Kitts and Nevis NCD Alliance is celebrating this week throughout the whole of October. So how about we start off by even discussing what even are non-communicable diseases. So Dr. Tivon Browne, how about you kick us off? What are non-communicable diseases, and can you share some examples for us tonight?
Okay, no problem. So non-communicable diseases are diseases that you cannot catch from another person, hence the non-communicable. Examples of this include things like diabetes type 2 or type 1, obesity, hypertension, and other things like that.
So as opposed to like the flu or the cold that you would catch, or HIV, this is something that you
can't catch from another person.
Okay.
It's just something you develop over time.
Okay, thank you. And Crannie, how aware, since we're very focused on youth tonight, how aware do you think young people are today in general, and I think it's at Nevis, and what do you think can be done to raise awareness?
Well, I would say that awareness is growing, and we must raise awareness through schools, advocating through programs and social media.
Mm-hmm. Social media is a big one, right? Especially for our age group, right? Right?
Yes, it is.
So what social media platforms do y'all think are popular in St. Kitts right now?
Social media platforms such as Facebook, YouTube, WhatsApp, TikTok for sure.
TikTok.
Love that TikTok.
I feel like TikTok is starting to take off, right?
Yes.
Mm-hmm. So would you say like, you said like programs, so it's like social media campaigns as well on videos?
Yes. Along with that, when we are doing social media campaigns, we must include an all-in-society approach, meaning that putting sign language in place just to include the deaf ones and have interpretation at all awareness programs.
That is such a good point, right? Because, you know, when we're designing a health program or a campaign, it's always important to think about who is your target population and it's not just youth, but there are several different groups within youth, right? So I think that's a great point. Interpretation, sign language, and just making sure that campaigns and initiatives not only get input from youth, but also to make sure that they're inclusive, right?
Yes.
Great point. So, Genesia, do you think NCDs are a priority issue for young people?
Well, I think it is a priority, but it really depends. And I think it depends on the awareness of the individual. So for persons who are more aware, of course, they would be focused on, you know, employing the preventative measures or the management measures, or seeking to learn more information about how they could treat or prevent it. However, I think in general, as it relates to young persons, typically there is a lack of awareness when it comes to, let's say, the cause of non-communicable diseases. Maybe we may be aware of, let's say, for example, diabetes and hypertension, but do we understand the impact of it, the impact of our lifestyle as it relates to our health, for example, or preventing or causing an increased risk of a non-communicable diseases. So for persons who are more aware, yes, and for persons who are not, then of course, you know.
So you think sometimes the knowledge might be just a little surface level?
Yes, the knowledge is surface level, you know, not in depth, as it ought to be or as it should be, because we are exposed to non-communicable diseases at an increased rate now more than ever, especially overweight and obesity. And I think that we do have work to do as it relates to raising the awareness of non-communicable diseases among young persons. Yes.
So I want to switch just a little bit to talk about different factors that might influence NCDs around us. So Tivon, I have a question for you. I'm wondering, what are your thoughts on the role of families and parents in creating awareness and promoting healthy behaviors that would prevent NCDs among children and adolescents?
That's a really good question. You know, I think that the home is where everything starts. How you raise children are how they're going to grow, how they're going to grow and continue their lives. What they see at home is what they replicate in their lives and what they replicate, you know, out in society. So if parents kind of, you know, set the initiative to raise the children in the way that they should, diets that they should adhere to, you know, simple as drinking water. Like if a child sees their parent drinking water, they're more likely to adopt that habit as a good thing going forward. But if it's just juice, sugar, more likely to consume that. Also with the diet that we have here, if you know, however, whatever they get fed at home is basically what they're gonna go forward seeking and also, you know, replicating in their lives. So if, you know, a parent kind of prepares meals how they should, the balanced diet with everything, children most likely to eat healthy, they're more likely to seek out these things. It's like most of us, you know, we grow up, and in our time, a lot of people would say vegetables are bad, they don't taste good, they're horrible. But if, you know, you take your time to prepare them in a way that's appeasing to a child or to someone, you know, they'll go forward kind of looking for that.
I think you made a lot of good points. sometimes parents say, do as I say, not as I do, right? But we need to practice what we preach.
Of course.
You also mentioned that it starts at a young age. So you don't want to start them off with unhealthy foods when they're young and all of a sudden, I mean, you know, if that's the path that you're on, you make the change when you can, right?
Yes,
but ideally, you make that change when you're younger. But I think that's a great point because it makes me think about my own niece, Ava. If anything she sees me do, she wants to do. She see me put cream on my face, where's my cream? You know, anything she sees me do, she wants to do.
Yeah.
That's my, and you know, I don't even have her full time. When she comes for the weekend, she wants to do everything.
Yeah,
that I
children
want to
very impressionable.
Yes.
Very, very.
Genesia had something to add?
Yes, I agree with Tivon, and I would say that parents are the first influencers of children. And even for mothers, for example, children or babies are already influenced or exposed to flavors and different tastes within the womb. And so I think we have to consider, you know, the different ways in which we need to start modeling healthy behaviors, right? And so that begins while a baby is within the womb. So of course, encouraging mothers to eat healthy foods while they are pregnant. And of course, the health of the parent, for example, mothers, of course, if they would have been diagnosed with diabetes, for example, of course, that may also expose the baby to be predisposed to having a non-communicable disease within childhood, and which may also progress into adulthood. So it's very important that parents model healthy behaviors at an early age and as your child continues to grow.
Right, so even before the child is, even before the mother gives birth,
Yes.
she should be practicing these healthy habits, because even as she is pregnant, what she does is impacting her child.
Exactly, yes, yes.
That's a good point, very insightful.
Yeah.
While we're talking with you, Genesia, I just want to say for our listeners that Genesia is also a registered dietitian. So she's our nutrition and dietitian, our expert here tonight on this topic. So this is a question especially for you. So you know, here, at least from my experience as a health education specialist, whenever we have conversations around health and around different foods and different nutritional aspects of a diet, people tend to say, well, you know, my macaroni pie, my scallop potato, with this, that. So the question is, and I like scallop potato. So the question is, how does the Caribbean's cultural diet and food practices contribute to NCDs among young people? And what's your advice for everyone?
Well, in terms of the Caribbean diet, I think based on our typical diet, for example, we're heavy on the starch, for example. So we tend to eat a lot of starchy foods, whether that be in the form of ground provision, whether it may be in the form of rice. When we consider our plate and the portions of our plate, it tends to be unbalanced. So for example, the majority of the plate tends to be starch. So it may be rice, you may have a side of, let's say, potato salad, and you may have the macaroni pie along with a large serving of meat, and you only have a little portion, probably less than a handful of vegetables, right? And that's the typical diet. That's how we grew up. That's our culture. That's our habit. That's our custom. And of course, it has led to the impact in terms of the high prevalence of diabetes within our culture. And our foods tend to be highly salty, highly seasoned. And so that has also been linked to, well, the high fat, high salt has been linked to the increased prevalence of hypertension within our community. So of course we have a lot of work to do, and the recommendation of course would be lifestyle changes. And so lifestyle changes as far as physical activity and a balanced diet. And of course that could be achieved by, of course, communicating with your healthcare providers, such as your doctor, your nurses, your dietitians, who would be able to of course, provide you with guidance as far as being able to achieve that healthy lifestyle.
Very insightful response, but I have a follow-up question.
Yes.
For me and the listeners, can we still have our scallop potato at the end of the day?
Well, I think it's subjective, and it's not to say you can't have your scallop potato, but you have to remember to balance your plate, right? Of course, if you're someone who has high cholesterol, for example, of course you have to consider cutting back on all of the saturated fats, the trans fats, the unhealthy fats, which would be in the cheeses that we tend to make the scallop potato with, or the butter that we may put into the scallop potato. But in general, it's not to say you can't have the scallop potato, but you have to be able to balance that. And by, of course, working with a dietitian, your dietitian would be able to guide you as far as how you should properly balance your plate. And that is subjective, right? But of course, the high fat, high salt, we have to be able to balance and control.
All right, so there's hope. Okay, there's hope. There's hope. I think the take-home message there was, if you're a healthy individual, then just try to have a balanced meal. If you have, take into consideration if you have a special condition, then you adjust accordingly. But there is hope. So thank you so much for that, Genesia. And we will see you in a few minutes. Thank you for listening. Welcome back to, as we said, a very special panel of all youth tonight. So we've been discussing non-communicable diseases, and we've spoken about diet, and we've spoken about different types of non-communicable diseases. So on the other side of diet, of course, we often hear about physical activity, or sometimes for some of us, physical inactivity. So I want to pose a question now to Tivon. What is the impact of physical activity on the rise of NCDs in youth populations?
Activity or inactivity?
Or inactivity. Or inactivity.
Well, I mean, that's great. As we know, physical activity helps us burn fat, helps us build muscle, helps us get the body in balance. These days, with the lack of active sports, outdoor play, the more into screens, screen time, television, people are less active these days. They're more at home, they're more scrolling through social media. And we're building up calories, we're still eating the same, we're actually eating even worse. We still got that calories being built up, less activity to burn the calories. And we're just adding on weight, stressing the body more, not working it how we should. And that's a really bad thing. I think we really need to get out there, get outside.
You think that's part of why non-communicable diseases are often referred to as like lifestyle diseases?
Oh yeah, that's a big part of it. Diet, exercise.
Genesia, did you have something to add?
Yes, and because of the physical inactivity, the excess calories, that has led to, or it can lead to weight gain. And of course, we in the Caribbean, we are facing a burden where there's a high prevalence of overweight and obesity among the youths, among young persons. And so physical inactivity, of course, can impact the health of our young persons causing or leading to non-communicable diseases such as heart disease, diabetes, and others. So yes, physical inactivity
It's a problem.
is a problem. Yes.
So, Crannie, I would love to hear your thoughts on this. What do you think about the screen time? Tivon mentioned that in his response. So, screen time, social media, how is that impacting our physical activity these days? And do you have any thoughts on what we should be doing differently?
Well, I think that we should be limiting the screen time to children, having physical activity after a certain time, creating an action plan as to the timing and how you're gonna how you're gonna help fosters physical activity.
It sounds almost like, and tell me if I'm on the right path, like almost like having a schedule for your child as to, okay, this is the time that they will spend at school and they come home, this is how much time they can have with their tablets or TV, but then we're going to switch to reading and we're going to go outside and we're going to do other things.
Yes. Yes, because it can be started at a shorter time, then you can increase it just to see how best it works.
So you just kind of, do a little trial and error and test out with your child,
Yes.
like how much time, see what that impact is on their behavior and see what the impact is on their health and see what more time outside, more time exercising can do. And similar to what you said earlier, Tivon, you have to be that example for your child, because when I exercise, my niece wants to exercise. When I do think she's excited to go for a walk if I say let's go for a walk, right? And so really setting that example for your child.
Yeah, the modeling behavior.
So I want to shift just a little bit to talking about some of these risk factors beyond exercise and beyond just typical Caribbean diet of foods. I want us to shift a little bit to certain industries around us, such as tobacco, alcohol, air pollution. So Tivon, this question I have is for you. How do health harming industries contribute to exposure to NCDs, such as the tobacco, such as alcohol, such as sugar sweetened beverages or air pollution?
Well, these industries, they're really good at what they do, eh? Or they wouldn't be existing. So the thing about them, they are widely available at really cheap prices. And they target youth, the youth consumer, directly and indirectly, especially the tobacco industry. They make it seem like it's for adults, but they have the fruity flavored vapes. These who else wants fruity flavored substances?
I would love to hear more about your opinion on vapes, and because not to interrupt, but there's more conversations happening around vaping now, and a lot of people didn't even realize that vaping was an issue here in the Caribbean.
Oh yeah.
However, apparently it is. So tell us more about vaping and your opinions on that and our health.
I think vaping is as bad or even worse than regular cigarette and tobacco use, because oftentimes the users, as you said, they don't know that this is tobacco. You ask these kids, what's in this? They don't know it's tobacco, so they often ingest it more often than a cigarette. It tastes better. It's easier to digest. You could ingest more of it in your lungs, and it's really stretching the lungs more than the cigarette smoke. Yeah, so a lot of these kids end up with emphysema, early stage lung failure, fibrosis, these kind of things, because of the overuse of these things. And these vapes also, they contain other harmful chemicals other than just the tobacco and their harmful elements, the preservatives, the coloring, all of these other elements. So it's way worse. I think it's worse, and I think if you look at the data from the UK or US, you'd see a lot of these kids who've been involved in the vaping, they kind of been developing a lot of deficits, a lot of rise in asthma and these kind of things.
Do you all think that parents are aware of this vaping issue? Do you think that parents are aware that, you know, the children potentially have access to vapes? Do you think they're aware that the children might purchase or use vapes?
But to me, I think a lot of them don't, because, you know, these devices, they're really conspicuous.
Yeah.
You know, you put it somewhere, you don't even know what it is. It's another device or something that these kids are using, right?
Mm-hmm.
So a parent might see it and just think, oh, this is another game, or it's a toy or something like that. And you can't even smell the tobacco on them. It smells like fruit.
Mm-hmm.
So they could use it freely and just walk by you with no issue at all.
This is very problematic. So would you suggest that parents, especially if you're listening right now, do some research, Google, try to figure out, like, find out what this looks like so that they can identify if they were to see it around, so that they can know what's happening?
Definitely, and even like identify the symptoms of, you know, tobacco intoxication in your child, you know. It would be a big help.
Are you able to share one of those symptoms tonight?
Tobacco, I mean, it kind of wakes you up. It peps you up. Yeah, it's like a stimulant to some extent. Oh.
So if you see a difference in your child's, you know, regular demeanor, then you might want to start doing some research, maybe start asking some questions around that. But I think that's very important, because vaping, and you mentioned the marketing, and we can talk about marketing on a broader scale. You mentioned how vaping is often described as something that is better than cigarettes, and it's less harmful, and sometimes even it's, to me, marketed as being cool. I mean, Crannie, I asked you earlier about the social media and the social media influencers. I don't know about y'all, but I've seen on social media people so freely talk about vaping and oh, they're going to step out for a vape, or even some of these musicians. So Crannie, what are your thoughts on the social media influencers and the musicians and the influence they have on you?
Well, my thoughts is that sometimes kids see us as adults doing these type of things and wants to follow. So I would suggest that we encourage our children not to do so.
So not to follow what they see other people doing, and so, you know, it's important to have conversations with your children, right? To make sure that they know. And
also having public education, probably in schools and other public institutions.
So we need more education around vaping.
Definitely.
I think that's a good point. Not just for the parents to educate themselves, but we need also a collective effort in the educational system to really raise awareness around vapes. So while we're on marketing, you know, as we get close to back to school time, I don't know about y'all, but on Instagram, I'm seeing these sponsored posts. Won't name anybody, but you see these certain drinks, certain snacks. I'm not even school age anymore, but it's coming across my timeline and my news feed, right? Saying, you know, back to school, whatever, something about education or for minds. So what do you think in a nutshell, and I'll pose this to you, Genesia, what do you think about this marketing and what do you think should be done?
Well, in terms of the marketing, of course, they are strategically targeting children around specific times. And it's very important that the government, for example, what is the role of the government? They could implement regulations that would help to target or prohibit marketing to children. Of course, there's the awareness campaigns or health promotion initiatives that could be put in place to educate the parents as well as the children to be able to know, okay, how to detect the different strategies that food manufacturers would put in place or could put in place that could potentially influence their habits, of course, for the worse.
Great point. And when we come back from the break, we are going to discuss policies in further detail, because that was a great point, Genesia. What can be done not only by us, not only by parents, but what can be done by all factors and sectors of society, including the government. So join us after the break for a healthy discussion around policy and advocacy.
All is well in St. Kitts and Nevis, a haven of natural beauty and cultural richness. The steel pans echo the rhythm of life, and our tourist attractions dazzle with their charm. But is all truly well?
In the quiet corridors of our hospitals, a different reality unfolds. Non-communicable diseases silently grip our community. This is a call for action. The beauty of our island should not mask the pressing health crisis we face. Behind the scenes, lives are altered by the silent threat of non-communicable diseases. Heart disease, diabetes, and respiratory issues are on the rise.
Our hospitals are strained, and our people are suffering. It's time for effective change.
All is well. It's time to redefine what well truly means.
Let us work together with health policies such as a sugar-sweetened beverage taxation, a school nutrition policy, and front-of-package warning labels to ensure a future where all is well is more than just a phrase. It's a reality for every single citizen of St. Kitts and Nevis. This message is brought to you by youth health advocates from Lake Health and Wellbeing, Fiona Zhang and Genesia Pemberton, for the Healthy Stat, Healthy Hat campaign.
Caribbean people, let's get serious about trans fats. These are industrially produced fats which clog arteries and are found in many processed, fried, and baked foods. They need to go. Policymakers, remember our commitment to eliminate trans fats from our food supply by December 2025? We must follow through. Eliminating trans fats can help prevent so much suffering and death from heart disease, curb soaring healthcare costs, protect our region from being a dumping ground for unhealthy products. Because let's be real, if we don't regulate, we will continue consuming products with trans fats that many other countries have banned because of the danger. Trans fats kill. Let's develop and enforce policies to ensure we're not making or importing this harmful substance. Eliminating them is a win for all of us.
Welcome back to the panel with all youth. We have some new faces joining the panel here for this segment. So firstly, I would like to welcome Davina Slader, youth health advocate of Lake Health and Wellbeing, and she also works with the Ministry of Health here in St. Kitts and Nevis. I'd also like to introduce to you Fiona Zhang, youth health advocate of Lake Health and Wellbeing. Welcome to both of you tonight.
Thank you so much.
So before the break, we began discussing policy. We're talking about marketing, right? Around back to school time, when you have all these ads bombarding you on Facebook, on Instagram, sponsored posts about different beverages and snacks that may be marketed as healthy or maybe marketed as something that you should give your child to go to school with. And Genesia, before the break, mentioned that perhaps the government can put in regulations around marketing. So Fiona, I would like to know, what are your thoughts around what can be done to protect children during back to school time, leading up to school, and from marketing and to promote healthy diets?
Definitely. I think that youth have the power to lead by example, and schools are basically where young children would spend most of their time, if not a lot of their time, definitely. So I do see a lot of potential for young people to recognize the risk factors of non-communicable diseases, especially through understanding, how healthy diets are formed, how healthy habits can be adopted, and the advertisements and marketing of these sugar-sweetened beverages and ultra-processed foods are quite aggressive, but with the proper education, I do think that young people have the chance and have the capabilities to identify these risk factors and also understand that, if you make the healthy choices now, they lead to a much healthier lifestyle.
So education early on and empowering youth to know that they do have power in this situation, right? So a question to you all in terms of on the policy side now, while we're educating you, do you have thoughts on what should be done around policy to protect youth or to promote healthy diets? Either Davina or Tivon.
Well, I think that youth should be able to advocate for themselves also, because these policies should be driven by them. So they should know what they should need in terms of the policy and what government should push in terms of what school should have. There should be a safe space for students so they'll be able to have foods and fruits that would be able to be targeted to that specific population. And I think that sometimes the government does not tailor these things towards youth. So I think them advocating for themselves would be ideal.
So we need more inclusion of youth even in the planning stages.
Right.
And we need to empower youth to advocate for themselves, to say, okay, include us. We want to be present, we want to inform this. And really and truly, for something to be successful, it needs to be informed by the people that you're serving.
Exactly.
True.
Because what's the point of coming up with anything, like whatever it is for diet, policy, school meals, initiatives, what campaigns? What's the point of coming up with something if you didn't even speak to who you're targeting or who you're serving? Because then you might, it's not only just for it to be effective, but you might waste your own time and resources if you don't consult and inform and integrate the opinions of youth from the beginning. That's a great point. So I want to dive a little bit deeper into policies and let's talk about school nutrition policy while we're on the topic of education. So school nutrition policies, I believe Barbados has their own school nutrition policy now that has in place that there's no marketing of processed foods in schools. So while you're at school, while you are learning about healthy diets and learning about processed foods and drinks, there is this regulation in place, at least in Barbados right now, that it would protect students from the marketing of unhealthy foods while they're at school. What are your thoughts on this type of policy, and do you think that it has a place here in St. Kitts and Nevis?
Definitely, it's a really good policy. I mean, you can't be preaching one message but showing a different thing. I mean, it doesn't make sense. It confuses people, and more often than not, we're going to go with the easiest thing, which is sadly almost always the processed food. The easy meal you could get, the quick ready meal. And for the vendors as well, they want to make money. They want to sell something that's going to go fast, that's not going to stick with them and perish. So unfortunately, that's what they kind of push towards the kids and the other people involved. So there's somebody we should include in the message as well.
The vendors as well.
Oh yeah, definitely. The source.
Yeah. Fiona, you have any thoughts on that on school nutrition policy?
Yes, I do. Actually, I think it's a very good initiative, especially given the fact that we had recently also been engaged in some training sessions with the Sustainable Food Feeding Program. Yes, and they were basically trying to interest us in the idea of a school garden. And in that school garden, children young adults, adolescents, they're all able to engage in, hands-on activities to building, life skills, valuable life skills, like cultivating a greater sense of agriculture appreciation and environmental appreciation. And you're also able to connect with the food, the healthy foods that you want to see in the environment. So I do think that the school nutrition policy does come into play hand in hand. It's not just like on its own. It has to be like a collective effort with all the other health policies in place.
That's a good point too. The school gardens as well, and that particular program Fiona is discussing. It integrates school lessons. Like if you're already learning math, then they'll integrate math into the gardening of healthy foods. Or if you're learning English, whatever the subject is, they integrate it into the garden so that learning and that connection is built with the food that you're growing. And sometimes you're more likely to eat a food if you had a hand in preparing it, whether it's growing it or whether it is cooking it. So having children involved in gardening and then also having them involved in cooking at home is probably a good idea, right?
Oh yeah.
Yeah. So another policy I'd like us to touch on is sugar sweetened beverage policies. So here in St. Kitts and Nevis, a survey revealed that I think it was about 66% of youth between ages maybe 12 to 15, but around high school age, had consumed at least one sugar sweetened beverage per day. So, and one carbonated sugar sweetened beverage per day.
Per
so
day?
That, at least. So that doesn't mean that it could have been 5, it could have been 6, but at least one per day, and it's at least one carbonated. So remember, if it's carbonated, that is like soda or something. Imagine the other drinks, the sunny, the orange juice, the orange juice. The other drinks, like if you're drinking hot chocolate in the morning, etc. Some of these other juices. The sugar can add up, right? And a lot of times, like we just said, the marketing often targets younger people.
Yeah.
So what do you think about a sugar-sweetened beverage tax? And I actually, I'm going to turn to Fiona really quickly. We might get to the opinions after the break. But before the break, Fiona, I want you to quickly explain to us what even is a sugar-sweetened beverage tax.
Okay, so what we're looking at is basically an excise tax that would typically be implemented on sugar-sweetened beverages, and those sugar-sweetened beverages would be anything from juice drinks, sodas, carbonated sodas. We're even looking at sports drinks, energy drinks, sweetened teas, and in the approach, I'm going to use this word very lightly, in the approach, we've seen other Caribbean countries, such as Barbados, who has already implemented a sugar-sweetened beverage tax, and they had done it at like a 10%, and that had resulted in a 6% decrease in SSB purchases and a 7.5 increase in bottled water.
Oh, Fiona coming with the numbers tonight.
She got the stats.
Fiona has the numbers for us tonight.
Yeah.
So I know we have to go to break, so we'll come right back. But thank you for pointing that out to us. And I just want to say before we go to break, Barbados actually raised their tax to 20% because of the success that they saw. So when we come back from the break, we'll talk about what that could look like for St. Kitts and what you think about the potential of these policies here. So join us after the break.
All is well in St. Kitts and Nevis, a haven of natural beauty and cultural richness. The steel pans echo the rhythm of life, and our tourist attractions dazzle with their charm. But is all truly well?
In the quiet corridors of our hospitals, a different reality unfolds. Non-communicable diseases silently grip our community. This is a call for action. The beauty of our islands should not mask the pressing health crisis we face. Behind the scenes, lives are altered by the silent threat of non-communicable diseases. Heart disease, diabetes, and respiratory issues are on the rise.
Our hospitals are strained, and our people are suffering. It's time for effective change.
All is well. It's time to redefine what well truly means.
Let us work together with health policies such as a sugar-sweetened beverage taxation, a school nutrition policy, and front-of-package warning labels to ensure a future where all is well is more than just a phrase. It's a reality for every single citizen of St. Kitts and Nevis. This message is brought to you by youth health advocates from Lake Health and Wellbeing, Fiona Zhang and Genesia Pemberton, for the Healthy Stat, Healthy Hat campaign.
Welcome back to our all-youth panel here tonight on ZIZ. We are rotating in and out a bit here, so you will see that we have kicked Tivon out. But thank you so much to Dr. Tivon Browne for his insightful responses tonight and his insightful conversation. And we welcome back registered dietitian and youth health advocate Genesia Pemberton to the table.
Thank you, Michele.
So before the break, we left off discussing, we were discussing a sugar-sweetened beverage policy and sugar-sweetened beverage tax. So Fiona spoke to us about what even is that a sugar-sweetened beverage tax. So of course, it is a tax on all sugary drinks, from sodas, bagged drinks, fruit juices, anything that has any added sugar in it. And then the price would increase, which the point would be to encourage people to think twice before they buy a sugary drink, and encourage people to purchase less sugary drinks, right? So Davina, I would love to know, what are your thoughts? Because Fiona said that this tax exists in Barbados. It exists in several different countries. It's in the Philippines, it's in Mexico, it's in the UK. It exists in several different places, and we've seen this tax actually effectively reduce the purchase of sugary drinks and increase the purchase of water, like Fiona said. So Davina, what are your thoughts on this policy? Do you envision that policy here in St. Kitts? What are your thoughts around that policy being implemented here in St. Kitts and Nevis?
Right, for sure. I think it can be implemented in St. Kitts and Nevis. I think we need an all-of-society approach, and stakeholders have to be invested into this policy because, as you know, it is affordable, and that's why persons would reach more for the sugar-sweetened beverages as opposed to water, which is much more least attractive, I guess, for persons. And I think that this is where a lot of the non-communicable diseases, that's where it stems from, our lifestyle in terms of going for these sugar-sweetened beverages, because, it can cause obesity, diabetes, all these things that can affect us in the long run. And I think in effective this policy, that it would be able to help us in St. Kitts to reduce some of this NCD problem.
So you'd say you're in favor for the policy?
Yeah, of course, I am.
So I just want to point out something quickly for the viewers as well. I like how you mentioned that it leads to several different NCDs. Just another fact for us tonight is just studies show that even just one sugary beverage a day, sugar-sweetened beverage a day, can lead to a 5-pound weight gain in 1 year. Now, I just wanted to think about the diet here in St. Kitts and Nevis when we have that hot chocolate or the sweetened tea in the morning, and then we might have a drink with our snack, and then one at lunch and one at dinner. That's about 4 drinks already right there per day. That's a 20-pound weight gain in a year. So just think before you drink, and think about how a sugar-sweetened beverage policy could benefit St. Kitts and Nevis. So just one more question about the sugar-sweetened beverage policy, and I pose it to Fiona. As we said, the tax would result in an increase in the price of these drinks, right? So then that is extra money, right? So what do you think should be done with the revenue from a sugar-sweetened beverage tax in St. Kitts?
Okay, so Since this year's theme for Global Week or Action on NCDs is It's Time to Lead, I think government officials, persons of authoritative power, and policymakers can all unleash vital funds into NCD strategies, and that would include maybe even allocating a dedicated fund towards subsidizing healthy foods, fresh vegetables, and even wholesome and nutritious options. And all that can lead to fostering more healthier habits among young people and even the generation at large. So I do think that's one way we can use the fund. But there's also other ways too, where you can also reinvest it back into public health initiatives, school education programs on nutrition, public health in general too. We can also look at maybe building infrastructure, such as urban planning, having more parks, more places for recreational activities, so that we can all engage in more physical activity, stay outside the doors and, maybe do a little jog, a 5-minute jog, maybe a 10-minute jog, maybe just down the street. Yeah.
All right, I like that. So I think that's a popular one, because I mean, how often do we hear people talk about the cost of fruits and vegetables in St. Kitts and Nevis? So if we had something like this sugar sweetened beverage tax, and we could use that revenue to subsidize fruits and vegetables, and then for public health in general, then that could alleviate some of the burden on families that people complain about right now. And also, we hear a lot of talk about universal health coverage. I know the Philippines use theirs for universal health coverage, so that's another consideration. I do want to shift just a little bit to speaking on the environment. So we've spoken about several different factors tonight. We talked about marketing, we talked about physical activity, the Caribbean diet, school, education, policy, the home. I would like to know your thoughts around One Health. So One Health is the concept that health of the environment is connected to health of people and health of animals. And I mean, quite frankly, if people are not healthy, is the planet healthy? If the planet isn't healthy, are people healthy? They're really connected. So I would like to pose this question to you, Genesia, on what do you think about the impact of environment on health? And then secondly, we see a lot of conversation now about the Sustainable Island State agenda. So, commendably, the Ministry of Sustainable Development, Climate, and Constituency Empowerment did hold a youth forum, and we commend them for that, for trying to include the youth perspective. So while we have youth here tonight, I would like to know, what are your thoughts on what would you like to see in the Sustainable Island State agenda, and what do you think about the impact of the environment on health?
Okay, so as far as the environmental impact on health, of course, it could directly or indirectly affect our health. And of course, for example, I'll tie it back to food, for example. When we are consuming sugar-sweetened beverages, of course, they are packaged in plastics, for example, and we have to consider how pollution would then result to a buildup of the plastics in the food systems. How would that impact our health as far as the development of non-communicable diseases? And we also have to consider, even in the creation of these plastics, how is the exhaust gases, for example, impacting our ozone, and that could indirectly impact our health as well. So we have to consider, of course, how the environment and the foods that we are consuming excessively can be a pollution to the environment, which ultimately may lead back to affecting our health for the worst. As far as the Sustainable Island Goals, of course, there were 7 pillars listed. Health was excluded from the 7 pillars. And as a young person, I would personally like to see health listed as the 8th pillar, as far as, because we do have to achieve or address the issue of health. Ultimately, when we think of our community, health is, I think, the overarching goal, or it is the overarching influence. And so health has to do with the well-being as far as food safety, food security, and health touches on every single aspect. So I do think that it should be included as a pillar.
What do y'all think about that, Davina and Fiona?
Yeah, I'm also passionate about health being included in the pillars, because I think that it's vital as humans that we advocate for the rights of our health and also the environment. And if we don't do that, then I find that we won't be accomplishing a lot of the goals that are actually there. So yeah, I definitely do support Genesia in saying that.
Very insightful, and I would support that as well. Obviously, adding health to the Sustainable Island State agenda. Now, before we close, I would just like to ask, really all of you, whoever wants to take this question. We've spoken about so many different factors tonight, but the theme for Global Week for Action on NCDs is time to lead. For that week, we also highlighted 35 under 35 health leaders here in St. Kitts and Nevis. So please do check out Lake Health and Wellbeing's Facebook page. Check out our Instagram so you can see all of those young people who are nominated for leading in health. But while we're on the topic of leadership, I would like to know from you all, what are your thoughts on what can be done to increase leadership in St. Kitts? What should the leadership and what should be the leaders, the governments, the policymakers, what should they be doing to lead on NCDs?
I think an overlooked aspect would be youth engagement. I think there's a lack of youth engagement, especially you did mention before that if you're going to have health policies in place specifically targeting towards younger persons and the adolescent group or the youth group in general, you should have their input because they are rightfully a part of your population. And if you do not have their insights or their unique perspectives, you are missing out on a very important aspect that you may not have considered when you were drafting or maybe thinking about proposing certain things in your policies. And I do think that if you want to have more young people engaged and involved, a lot of the work has to be relevant, has to be relatable, and of course fun and engaging too. So yeah, I think it's a great
more
opportunity.
Youth engagement.
Yeah,
definitely.
it's a great opportunity.
Yes.
Any last words to add to what we want to see from leaders?
I agree with Fiona. Definitely engage young people in the various initiatives, engage us in the decision-making process when it comes to the policy. So I agree completely with what Fiona would have mentioned.
I think also that we need to target a lot of where these youths are, like the spaces, so the schools, churches, anywhere that youth are actually involved in, we are supposed to go there and see what youth are actually needing in those, and the needs that are actually met by the government and the policies that are driven. We can make sure that the government knows that they're targeting that.
All right, thank you so much, Genesia, Davina, Fiona. I think we had a very lively discussion here tonight. You heard from many young people about what they're asking for. We want leadership. It is time to lead. We want youth engagement. We want healthy policies that we've seen work across different Caribbean islands. And we want everybody to play a part in creating a healthier St. Kitts and Nevis. Thank you so much for joining us this evening, and you have a wonderful night.
Welcome to the beautiful islands of St. Kitts and Nevis. Today, we'll be spending time with the Wilberts. They're a happy family that love liming, and with plenty of food and drink to go around, life is good, but not for long. Sadly, the Wilberts never paid attention to what they ate or drank. And when asked to reduce those sugary drinks, they joked and said, "We will, but not today." Unfortunately, a year later, Mr. Wilbert had a stroke. And a few months after that, Mrs. Wilbert was diagnosed with diabetes. From hospital bills and the cost of drugs to time off work, this began to take its toll on the family. But it wasn't until they saw the effect it was having on their children that they finally decided to make a change. You see, the Wilberts realized their family was already sweet enough, and a healthy lifestyle was the best gift they could ever give them. What gift will you give your children?